Hey everybody, I'm here with Dr. Tehrani at Aristocrat Plastic Surgery. You can find them at aristocratps.com. So we're here to talk about cosmetic surgery and some of the common exciting treatments and procedures available today. So thank you very much for joining us today, Doctor. I appreciate it.
Thank you for having me.
Yeah, absolutely. And I wanted to start off just by asking how long you've been working as a plastic surgeon.
I'm a board certified plastic surgeon in private practice now, 17 years.
Okay, awesome. And was there anything in particular that really, made you want to get into that, be able to help people with their goals?
My initial intake into plastic surgery was when I saw a very large reconstruction of a mandible where somebody had cancer in their mandible and unfortunately had to have the removal of their jawline. And the plastic surgery team, at the time I was a medical student, put together a portion of the mandible and the surrounding tissues with bone that was removed from the leg effectively, and reconstructed that, and that was the most amazing thing I'd ever seen, and that's what I wanted to do. That progressed into plastic surgery, which is a combination of reconstructive and aesthetic surgery, and form and function being a part of it. And then in my private practice, that's basically progressed into more cosmetic as opposed to reconstructive plastic surgery.
I got you. Okay. Yeah, that's incredible. The advancements and being able to do that help people out.
Absolutely.
Sure. And then since the pandemic has come to a bit of a close here, have you guys noticed an increase in patients coming back in for procedures?
I think what the pandemic did is a lot of Zoom, a lot of patients basically looking at themselves on a screen. That, and even before the pandemic, a lot more social media, a lot of Instagram, a lot of kind of started with selfies, but then it actually came into basically people looking at themselves all the time, and finding things that are easily correctable with either injections or non-surgical procedures, and B, actually looking for surgical options for long-term solutions for either nose jobs, especially neck, especially most devices look at you from bottom up. So neck procedures became a lot in vogue, and combine that with the fact that people had a lot of downtime, a lot of working from home, more of a recovery type element to their post-operative routine that accommodated a huge surge into the amount of procedures that were asking to be done right after the pandemic, and we opened up. Combine that with the backlog of the patients that we had beforehand, so it's been a huge increase. Now, a lot of that has been caught up, and now we're seeing kind of like a normal slowdown right before the summer when everybody's getting ready to go away and they're not getting into the bikinis. They don't want a downtime right after surgery. And that's a normal progression of things that didn't happen last year.
Definitely. Yeah, I hear you. And what are some of the main treatments and procedures that you provide there at your clinic?
We're at all comprehensive face and body plastic surgery procedure. We're almost like an aesthetic destination for whether or not being a facial injectable or facelift, eyelid lift, body procedures. I do a lot of breast augmentations, some through the belly button, and some specialty mommy makeovers. So that's the majority of the procedures that I perform. Having said that, right after the pandemic, and including now, things that have really evolved and been more of a ask have been facial procedures, nose job, non-surgical nose job, neck lift, MyEllevate procedure, multiple other procedures that are more facially based.
Absolutely. Yeah, and the advancement in those different treatments and then the different techniques with the existing treatments has been incredible over the last 5-10 years or so.
Absolutely. And some of the procedures are even newer than that. And there's always one of the things that changes a lot in our field is how progressively advanced we get with different companies really coming out with more innovative treatments, how to treat things with less downtime, less surgical intervention, and not to replace like a facelift down the line, but it used to be that you turned 50 and you got a facelift, and now we're doing a lot of things to kind of keep the patients until the time that they actually truly need a facelift, which may be their 60s as opposed to 50s. and doing a lot of other anti-aging stuff that goes along with it to progress and not have somebody have 3 to 4 facelifts in a lifetime, which makes it look funky, as opposed to having it one time and then doing these ancillary procedures to keep it very natural and good looking through the progress and through the progression of their aesthetic, almost like a journey.
Definitely. Yeah, absolutely. What are some of those specific procedures that you would recommend, doing before and then maybe even after the facelift?
One of the procedures that I do a lot of, and it's typically for before somebody needs a facelift, and as early as in the 30s, but more prominently in the late 40s to 50s, is a procedure called a neck or MyEllevate procedure of the neck. It's basically a closed neck lift. It's a neck lift where we pass a special catheter and put a permanent suture to lift up the skin of the neck. At the same time, we tighten the skin of the neck with liposuction and internal skin tightening. So effectively, you end up with no cuts, and these are all done through tiny little holes. It still has about a 3 to 5 day downtime. It is done under local anesthesia, so you're not going to sleep. So it checks off all those boxes of, even though it's minimally invasive, it does not require a huge downtime. It doesn't have incisions. It doesn't have long recovery. So all those things are more manageable, especially now with a face mask on or people having a little bit of downtime. It's typically like a long weekend in terms of a recovery, and most people can afford that kind of time off.
Yeah, that's not bad at all. What's the average surgical time that takes?
It takes about half an hour to 45 minutes to do. Most patients are very comfortable. We usually give them a little bit of Valium to just keep them comfortable. It's kind of like going to the dentist where you get some shots to numb up the area. And after that, it's just movement. I mean, you're moving, and a lot of times we're listening to music or having the patients participate, not in the surgical part of the procedure, but actually I need them to extend their neck and move things around for me to see the dynamics of how their neck lines lie and to provide that nice chiseled jawline for them.
Definitely. So that's a good procedure for them to kind of start with, and then that gives them a little bit more of a youthful appearance before,
Correct. And you combine that with facial injectables, with Botox, with some non-surgical thread lifts of the face, and then you're not doing a facelift for a good 5 to 10 years. So then this next procedure is actually a long-lasting procedure, lasts up to 5 years. So it's a long-lasting, non-surgical, even though it's minimally invasive, it's not cutting surgical procedure.
Yeah, definitely. And then once they actually, if they do go forward and have the facelift done, you're saying that you guys have a much better success rate as far as how long that will last as well?
Correct. On average, a full facelift probably lasts about 10 years.
Okay.
So if you had a facelift in your 50s, when you turn 60, somebody wants to look good still, they're on the second facelift already. Or even in their 70s, they may get a third one. So whereas if you keep that along and keep it natural, up until in the 60s, early 60s, you do that facelift one time, you get 10, 15 years out of that. You may do another one of these MyEllevate after that, and then you end up having one facelift in your lifetime as opposed to 3 to 4, and with untoward kind of the fake looking thing that you want. And some people that want the really pulled face look, and it's not for that person, it's for the person that wants a natural, and most people want more of a natural, better look for themselves as opposed to turning the clock back 30 years. It's not about that. They just want to look refreshed. They actually don't want most people to know about it. Unlike a lot of the other procedures that I do, so like for example, breast augmentation, patients are very proud to say, hey, I had a breast augmentation. And they share with their friends. Most people getting a facelift don't do that. Most people getting a facelift are very hush-hush about it. Some people don't even tell their loved ones having it until after the fact. So, occasionally I get asked from somebody who's like, can you not have your credit card say plastic surgery, because I don't want to explain the charge on my bill. And obviously it's there, but a lot of times it's just kind of goes under the radar a little bit. But it's tough to have a facelift go under the radar.
Yeah, absolutely. And I can tell, I mean, with you guys, really focusing on it being more of a refreshed look, and you're doing the longer term care of the patient, and it's not just one time and then come back in. So yeah, definitely. I think that's definitely the big push, recently, is more of just a refreshed look, and it's not trying to, just have like crazy unrealistic results with it.
Absolutely. And about, kind of making the better version of themselves and a refreshed version of themselves as opposed to turn the clock back 30 years or something ridiculous like that. And they understand, most people understand that it's not it's something, and I hate to belittle surgery to say things along the lines of, getting your hair done or getting getting a facial. It just makes you feel better. It does look better, certainly, but it's that vanity of making sure that you do it safely, yet at the same time you don't kind of cut corners and take the clock back to the point where it kind of starts looking off, and it doesn't go with the whole overall long-term plan of the patient still kind of having that anti-aging refreshed look for as good as they feel on the inside to kind of present that way on the outside.
Yeah, absolutely. And that's why also we love doing these type of interviews too, just to get that education out there. And obviously, a lot of patients, when they hear this is making a lot more sense than just, let's try to do one procedure and just take the clock back 15, 20 years.
Absolutely. Yes.
Definitely. Okay. And then in terms of, overall health and everything, who would you say is, an ideal candidate for doing the MyEllevate and then potentially doing the facelift?
Ideally, is a candidate that has some laxity of their neck, have a little bit of fat, sometimes a double chin here in this area, where we can actually remove the fat with liposuction and tighten the skin. Starting to see some jowls here in this area that start kind of coming down, if you're starting to see a little bit of that. So it's somebody who's really not a facelift candidate yet. And it's somebody that is just noticing, my makeup doesn't cover this anymore. I used to like this area on my face, and it's not really what it used to be. And I hear this very commonly. They're like, it kind of happened overnight. And
Right.
a lot of people say that. Obviously, it didn't happen overnight, but somehow along the line, overnight, it actually started really bothering them. And that overnight could be just kind of like looking at the Zoom every day in and out. And there's studies that show half the time that you're on a Zoom while you're speaking, you're actually looking at the other person. But when the other person is speaking, the entire time you're looking at yourself. So, so that kind of really brings it to the point. Yeah.
Yeah, absolutely. So if they have some extra kind of skin and fat on the face, the MyEllevate can help bring that down as well.
Correct.
Okay, definitely. Yeah, that's awesome to hear. And then can you explain a little bit more about what the actual procedure does? So just so I can understand, what so it's minimally invasive, and then you're just—
So minimally, it's a tiny little incision, tiny little holes all throughout the neck. The most incredible part of the procedure is that some of the neck muscles, I'm going to show on myself, I'm going to show you my bottom teeth like that. And these muscles are the platysmal muscles. And that's part of the aging process. And we can actually delicately, with a suture material, very gently actually make a cut in the muscle so we can actually pull it back like a hammock back out to the side to really lift up the neck. And when the muscles are separated like that, they don't grow back because they, body heals. And if you leave the muscles next to each other, they're going to heal again. So with the suture, we can actually separate those so that they can actually elevate the neck up higher, combine that with no more fat, combine that with skin tightening done by Renuvion or J Plasma on the neck, on the inside, and collagen building, you get a rejuvenated neck and pre-jowl area both.
Okay, definitely. And then it's fairly easy for you guys to go back in and do another one of those procedures later on.
Yeah, either one more time before you need a facelift or to a facelift procedure. Yeah, it does not cause any scarring or any dramatic change. It's a very natural lifted look. Even though the suture is permanent, the tissues themselves are still in their anatomical position.
Okay. So if you guys go back
or anatomical uplifted position.
Right. So when you guys go back in, do you remove that original suture, or are you putting in another one on top?
I have removed it if it looked like it's in the way of the next suture, or it just remains there, and then we what's called plicate or additionally tighten above it.
Okay. And then lastly, do you have any, last advice for a patient that's maybe listening to this, has been thinking about, facelift or having something done in their neck and is thinking about coming to see you for a consultation?
Absolutely. The people you ask for patients that are good candidate, and we spoke about that. Patients that are not good candidates are smokers. Smokers, unfortunately, will actually have healing issues in that area, and you don't get the tightening that you require. And so I request patients to actually stop smoking 2 weeks before and hopefully never after. But as long as they have 2 weeks and 2 weeks before and after surgery, it is something that is quite helpful. And also make sure that you see a board certified plastic surgeon that has experience with this procedure. And you have to be certified to do this procedure, MyEllevate procedure. And there is online certification body that you'll be able to see who can actually do this type of procedure. It's innovative. It's a very smart procedure that's out there. And in the grand scheme of things, it's a newer procedure, but it's been around more than 10 years. So it's really tried and true. But it's a procedure that not every plastic surgeon, even not every board certified plastic surgeon does.
Okay, perfect. And then what would be the best way for these patients to reach out to you guys and get in contact for that consultation?
Either call our offices, either Manhattan or Long Island offices, by phone to make an appointment. We have virtual appointments. Of course, we can take a look at the patients virtually on our website, and of course on Instagram at Real Dr. NYC.
Okay, perfect. All right. Well, thank you so much for taking the time to talk with us today and share that information. That was awesome.
All right, pleasure. Thank you so much.
Have a good rest of your day. Appreciate it.
You too.